Assalamu alaikum. So in this video, we'll be talking about the MRI scan for patients who having disc prolapse. In our previous video, we talked about the normal MRI scan, and that's why I'm making this second video about disc prolapses, which is one of the most common pathologies that you can see on MRI scan. And that's why you can compare the normal anatomy that you kept in your mind from the previous video, and now you can appreciate how to read an MRI scan and find out the disc prolapse within the lumbar MRI scan. I am Mohammed Draz, and this is your knowledge platform about the brain, spine, and beyond. So if we look at this first patient, we will go through the same systematic approach that we have done to look into the MRI scans of the normal MRI scan. And then this is a T2 sagittal image, as you can see. We will look at the alignment of the spine. The spine looks all very well aligned. There is no stepping, there is no movement. The shape of the vertebra looks all right. The the signal within the discs looks all right. So this one is all right, this one is all right. But here you can see that this one, the signal is different compared to the other ones. So this is a little bit hypo intense. And this one is even more hypo intense. So we can't see this grayish color here. Looking at the CSF, it's all going smoothly and in kind of a smooth line. But as we go here, there might be a little bit of bulge here, but it's not obvious. But here at the L5S1, there is a very clear bulge. And that's basically a disc prolapse. If we move the image a little bit, you can see that's very, very obvious. It's kind of going through all the way through the canal. So that's causing pressure on the cauda equina. So if we go from the right to the left, as you can see, that's all disc prolapse, which is hypointense. As we said before, we look laterally to look at the nerve roots. So in the foramina, this is the nerve root, looks fine. This one looks all right. This one looks all right. This one is, a little bit squashed on one side, which is understandable. And on the other side as well, it's not that not a huge amount of pressure, but again, you can see the difference between this one and the others. So what we do here, we have to look into the T2. So let's have a look on the T2. I will just show a normal level first. So again, as we said, we look at the CSF, we look at the nerve roots within the cauda equina, looks fine. But as we scroll down here, you can see obviously very clearly there is a large disc prolapse, large fragment. It's pushing the thecal sac towards the left side. That disc is on the right side, kind of posterior central or more central. It's more on the right side, so I would expect the patient to have a bit more right-sided symptoms rather than left-sided symptoms. Again, don't forget to look at the other things, including the muscles, including the facet joints, including the nerve roots, including the vertebral body, and if there is any other pathology. So that's very obvious disc prolapse. Let's have a look on another patient. This is another sagittal MRI scan. Again, similar kind of structured way of looking at the image. But as we scroll here, again, that's very, very obvious. You can see there is something coming out here. Which level is that? That's S1, that's 5. So again, that's 5, L5, that's L4. So it's an L4 disc prolapse. And as you can see, what's characteristic about this one, that's why I'm showing it, it's that the disc prolapse is migrating cranially. So it's going up towards, kind of behind the body of L4 rather than being central or within the same level as the previous one. So the disc can actually migrate either up or down, and we'll show an example of caudal migration in the next one. What we do about this one, we'll look at the T2 again. And if we go here, I'll just show a normal one. And then if we move to this one, it's very obvious that a disc prolapse on the left side and pushing the thecal sac. You can see the nerve roots in the cauda equina are all crowded here, and that's more on the left side. And it's very obvious how big is that disc fragment. So it's kind of more towards the left side, but then it starts to move kind of a bit more central. Let's have a look into another one. So again, what do we have here? We have a T2 sagittal image. Look at the intensity of the or within the disc itself. That looks grayish. That one is black colored. That one is black colored. But also this one is kind of squashed. The space itself is smaller. And what you can see as you scroll, you can see a huge fragment, but rather than going up as the previous image, it's going down. So you can see that's a disc prolapse. Which level is that? That's 5, that's S1. So it's an L5 S1 disc prolapse caudally migrating towards behind the sacrum. What we do here, we look at the T2 axial image, and that's just the top. As we go down, again, that's all normal. CSF, that's the cauda equina nerve roots. And as we go, we would expect something here, very obvious, kind of hypointense, very large disc coming out, more on the left side, pushing the thecal sac. And as we go, still there on the left side, pushing the thecal sac and causing pressure on the nerve root. What I haven't seen is, let's have a look on the nerve root. So that nerve root, teardrop, teardrop, teardrop looks fine. Let's have a look on the other one. Again, teardrop, teardrop, teardrop. Might be a bit of pressure, but not that clear. Let's have a look into a different one. That's boom. That's very easy. You should be recognizing this once I open this picture. Again, look at the alignment. The spine looks a little bit more kind of straight in comparison to the previous ones. The intensity within the signal here, it looks normal, but this one is black, this one is black, and boom, there is a big one here. That's a big disc that's between the level L4 and L5. And again, it's kind of migrating down behind the L5 vertebral body. If we go from one side to another, again, the nerve roots, teardrop, teardrop. If we go to the other side, again, teardrop and teardrop. And that's, again, a migrating disc prolapse at L4-5. Let's have a look on the T2. Again, if we look here, boom, that's on the right side, causing pressure and pushing the thecal sac. You can see the nerve roots, the dots are crowded towards the left side, and that's a right-sided disc prolapse. Again, just to remind you, this is how it looks like normal. And if we move here, that's where it looks like a big disc causing pressure on the right side. Let's have a look on the final one, and I'm showing this one because it's slightly different. So here what we can see, again, the alignment of the spine. We can see the signal within the disc. Again, that looks abnormal. That looks abnormal. The disc space here looks smaller. And if we look here, again, within the center, it looks all right. There might be a bit of disc bulge here between 5S1. Again, there might be something here at L4-5. If we look lateral onto the nerve roots, that's a nerve root on one side, a nerve root, again, teardrop, teardrop, all looks fine. If we look on the other side, and if we look here, that's the teardrop, but actually there is something here. So there's something kind of grayish here, which is causing pressure on this nerve root. Which nerve root is that? Then we look at, this is an L5 vertebra, that's an L4 vertebra. The nerve root that goes below the pedicle of L4 is the L4 nerve root. Below the level of the pedicle of L5 is the L5 nerve root. So which one is compressed here is basically the L4 nerve root. And if we look at the axial imaging here, again, within the center, that looks all right. That's probably the L5S1, which is, again, a bit of disc prolapse, might be causing a bit of lateral recess stenosis. But if we go higher up to the level above, what we can see here that there's probably something causing pressure on the L4 nerve root here, which is that grayish, kind of grayish color here. That's this one there. So that's basically a lateral disc or disc coming in the foramen, which is causing pressure on the L4 nerve root. What usually happens with any disc prolapse, that the L4-5 disc prolapse usually causes pressure on the L5 nerve root, and L4-5 and L5S1 will cause pressure on S1 nerve root, and L3-4 will cause pressure on the L4 nerve root. And that's mainly because most commonly the discs are kind of central or paracentral. But if the disc is more lateral, then it can cause a pressure on the nerve root on the level itself, higher up, which is the exiting nerve root rather than the transverse or the traversing nerve root. So in that case here, that's why I'm showing it, it's basically causing pressure of the L4 nerve root rather than the L5. I will make a separate video about which nerve root is being affected by in each level of the disc prolapse, because that's a very difficult part to appreciate and understand for a lot of people. So the next video will be about this point. I hope that you now have seen multiple patients and multiple MRI scans of different patients, about 5 cases now, which shows multiple types and multiple shapes of disc prolapses. This should be easy to recognize for you. If you haven't watched the previous video about the normal MRI scan, please watch this now and then head to the lumbar disc prolapse MRI scan video so that you can appreciate the difference between the both. Please share and subscribe our videos, subscribe to our newsletter, and follow us on LinkedIn. Sharing our content is really helpful because that helps our content to reach a wider audience. And if you can comment on the videos, that also helps the reach of those videos to a wider audience group on YouTube. Thank you.